Hello and welcome to today's information session on the School of Optometry at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Campbell. I'm Associate Director of Admission at the university. So I will be the one working with you all throughout the application process and all the way through to matriculation if you're planning on applying at any point in the future. And we also are joined here with a couple of current students as well as one of our faculty members. So let's start with Dr. Waldorf. Would you like to introduce yourself? Oh, you're on mute.
Yeah, I'm muted. Sure. I'm Dr. Greg Waldorf. I'm the Associate Dean for Clinical Programs. So that means I'm in charge of all things regarding clinical education. So if you have any questions about our clinical program, at the end of the program, you can ask and I'll answer anything you have. I teach 3 courses. I teach the ethics course before you start clinic, the summer of your first year. I teach public health, and I also teach a course called Special Populations, where I teach you how to work with the non-traditional patient as if they're sitting in your exam chair.
Thank you, Dr. Waldorf. And we also have our 2 current students. Let's start with Nazine.
Hi everyone, my name is Nazine. I'm second year optometry student here at MCPHS, and I'm from Kelowna, British Columbia, Canada. For those who don't know, it's all the way to the West Coast.
Thanks for being here, Nazine. And last but not least, Catherine Ann.
Hi, my name is Catherine Ann. I am a first year optometry student and I am from Scranton, Pennsylvania.
Awesome. Thank you guys for those introductions. We're really excited to talk to you this afternoon about all things optometry at MCPHS. I do want to make note too that this webinar is going to be recorded. So if for some reason you need to log out ahead of the end of it, I'll send the recording to you all later this week so you can, watch it back on your own time if you need to. We're also going to end the session with a brief Q&A. So if you have any final questions or wanted us to elaborate on anything you hear about through the presentation, we can certainly address that at the end of the session. So you'll be using the Q&A function on your screen, not the chat box. So just leave your questions in the Q&A and we will get to those at the end. So without further ado, let's get started. So I'm just going to start us off with some basic information about MCPHS. We are actually the oldest institution for higher education in Boston. So that's a bit of a fun fact for you. But these days, our Boston campus is primarily our undergraduate campus. We do have a couple grad programs there, but we expanded to Worcester, Massachusetts and Manchester, New Hampshire in the early 2000s as our professional phased campuses to kind of be able to capitalize on these other areas within New England to be able to expand to offer these professional graduate programs that, need a good amount of real estate to be able to provide proper clinics and lab spaces for them. So we're going to be mostly talking about our Worcester campus in today's presentation because that is where our optometry program takes place out of. But here's a little bit more about our locations here. So, of course, our Boston campus is our original campus. It is in the Longwood medical area of Boston, which is kind of known as the Mecca of healthcare for the East Coast and arguably the rest of the country. We're right across the street from Harvard Medical School and amongst a bunch of prestigious healthcare institutions like Beth Israel Deaconess Medical Center, Brigham and Women's, Boston Children's Hospital, Dana-Farber Cancer Institute. So it's a really great place to be if you're looking to go into healthcare. And then we're also in Worcester and Manchester, of course. So we're in a great area of Worcester, the downtown area. There's also a lot of really great healthcare opportunities around Worcester, which we'll talk a bit about in the next slide. We have 9 professional programs in Worcester, which not only include optometry, but also physician assistant studies, physical therapy, occupational therapy, dental hygiene, diagnostic medical sonography, nursing, pharmacy, and acupuncture. So that's our community in Worcester. Manchester, New Hampshire is very similar. There are 4 professional phased programs. So there are, no freshman students at either of those campuses. Everyone's working towards their own individual healthcare endeavor by the time that they attend either Worcester or Manchester. But for the sake of the optometry program, we will talk about Worcester in more detail. So if you're not super familiar with New England or Massachusetts, Worcester is only 45 minutes or so outside of the city of Boston, a bit more inland. And this is the second largest city in New England, and only about, like I said, a 45-minute drive or so from Boston, where you'll find our campus. And there is some great healthcare opportunities nearby. Even visible from our front steps is St. Vincent's Hospital. Some of our students may have clinical rotations there, but what is more relevant to our optometry program is that we have University of Massachusetts Chan Medical School just down the street. So they actually have an ophthalmology program where we get to refer some of our more complex patient cases to. And we also have been able to collaborate on a variety of research projects with them in the past. They've even donated a variety of like cadaver parts to our students. I think a couple of weeks ago, we got a pair of lungs that our anatomy students were all jazzed to play with. So really nice to have them in our backyard. And Worcester itself is very much so a college town. There are 12 other colleges and universities nearby. And you can always identify an MCPHS student through the white coats, as you can kind of see pictured here. So we're very easy to pick out of a crowd. And Worcester is really known for being a foodie city. It's very diverse. There is over 30 languages that are spoken here, and I think that that's really celebrated in the different types of cuisine that you'll experience when dining in the city. It's become one of my favorite things about the city too, is that it's not super gentrified where there's like a million and one chain restaurants around. A lot of these are independently owned, mom and pop style restaurants and cafes and things. So it really adds to the charm of the city. We also have a lot of great entertainment. So if you're looking to go see like a Broadway show, a touring Broadway show, or symphony orchestra or an indie band, or even like professional bull riding at times, we have all sorts of different venues that really border our campus, as well as two sports teams. We have a hockey team as well as a baseball team. So there's no shortage of things to do in the area. But since I have some current students here on the presentation, I'd love to ask Catherine Ann and Nazine what they like to do in their free time when they're in Worcester, if you guys wouldn't mind jumping in.
Yeah, of course. For me, I use my free time a lot to kind of just walk around. I really like going to the local coffee shops and cafes scattered throughout the city, as well as visiting the local parks. There are a few local parks around campus, so when it's warmer, it's really nice to kind of take some time and see some greenery. I have been to a few shows at the concert venue down the street and the theater when they offer shows that I am interested in. But overall, it's just a really cool, walkable vibe city. So, I mean, there's always something to do.
Yeah, I definitely agree. I love exploring the city. I do like to go to the coffee shops as well, but one of my favorite restaurant around Worcester is the Chashu Ramen and Izakaya. It's one of the best restaurants I've had for Asian food. I do love going to the Palladium, which is about 5 to 10 minute walk from where we have our classes at Lincoln. They do offer a lot of different concerts. They had an EDM festival, Breakaway Mass that happened in September. DCU Center has a lot of events as well. And yeah, it's very close to us.
Thank you all. I know it's kind of hard to find some free time in your schedule, so I think food is a really great alternative to kind of getting out of the study groove and to, have a nice social time with some of your classmates and such. So thank you for sharing that. I do want to add that we do have quite a few rural towns that surround Worcester. So if you were looking to kind of get out of the hustle and bustle of it all and wanted to go hiking or mountain biking or skiing and snowboarding, we even have a hiking mountain, or I guess a ski mountain that's 25 minutes away from our campus called Mount Wachusett. So if you are into that, or if you're not, if you wanted to try it, they even have, classes and things that you can take with rentals if you wanted to try to start, your skiing or snowboarding endeavors while you're here with us. Or if you are, experienced, you can certainly get a lift pass for the day. So really nice to have that nearby. We do also have a lot of public transportation. There's city bus, there's a commuter rail that goes between Worcester and Boston. Greyhound and Amtrak even go out of our city. So very well connected with other areas of New England and the rest of the country there. We can guarantee parking for our students, and we can also guarantee housing. This is kind of a unique offering for a graduate level program is to be able to provide on-campus housing. And it is something that we can guarantee to all students who are interested. We have 5 different residential options to choose from, ranging from studios all the way through to multi-bedroom apartments. And this is, like I said, primarily a graduate level population. So at this point, we understand that you're past that point of wanting to share a room with someone. So rest assured, all of our units are private. You just might have to share a bathroom or kitchen space with other students, at least depending on the accommodation that you choose. And I happen to know that both of our students here live on campus. Could you kind of tell us a little bit about where you live and what you like about it so far?
Yeah, for sure. So I really like living on campus. I live on Main Street Residence, which is a studio apartment. And one of the biggest reasons why I decided to choose Main was because I wanted a kitchen so I can cook. And it is semi-furnished. Honestly, Main is very clean and quiet. We do have a common area that has like a desk and chairs so we can like study if we want to. We do also have public safety on campus. So, for example, if I decide to stay late and study at Lincoln or at the library, they can always walk us back just to make sure we're safe. And it's very close to our classes. Like it's like only 10-minute walk from my classes. So it's like really great just because I can also get a fresh air and I can also have my own private bedroom.
For me, I live in the Lincoln building, which is actually connected to our academic building. So for me, like rolling out of bed if I really need to and walking downstairs to class is very convenient. It's also nice if, like I said, you're running a bit late, you forgot school materials, or it's really cold weather, you're just right there next to your classrooms. It's also nice living on campus because you have access to your labs 24/7. So for me, I could walk downstairs, go downstairs, study, go through my lab, do what I need to do. And then also living on campus, I have a lot of interactions with students that are not in my program. It's really nice to go across to my neighbor's unit and, talk about what she's learning, what they're doing for the day, and also kind of like network in a sense, but just to have like friends from outside the program.
Absolutely. Thank you both for that input. I also want to note that no matter where you choose to live on campus with us, everything will be furnished and all utilities will be included in the cost of rent. We do have students that come from all over the US and internationally for these programs, so it is nice to be able to kind of offer you somewhere to land should you need it. So here is a snapshot of the different programs that take place here on our Worcester campus. I kind of read through those a couple of slides ago, but we do have a nice mixture of both Eastern and Western medicine offered on our campus. So I do want to share that you will have the opportunity to collaborate with these different programs from time to time through what we call interprofessional education, or IPE for short. So here's a little bit more about IPE. At least once a semester, we bring all 9 of these programs together for our students to learn how to work with patients from different cultures and backgrounds, and ultimately how to work as a team once you're employed in the healthcare system. It's really become the university's take at, I guess, alleviating the current state of the healthcare system for our future generations that we do graduate. So we want to make sure that the students that enter the workforce are better prepared to collaborate interdisciplinary with each other. So we make this really a part of our mission here. So in the past, we've done an emergency medicine Narcan training. We've also done a dementia simulation where you really got to experience what a patient would be kind of navigating through life like who is experiencing dementia. We've also done a diabetes maintenance training. All of these sort of centered around the idea that no matter which profession you're a part of, you're going to be encountering patients who've struggled with addiction or who have dementia or who have diabetes. So this really just allows you to understand from your own area of expertise how you best can support these patients, and also how your colleagues from all those other areas are also able to intervene to provide support. Because after all, healthcare is highly collaborative, and your patient is likely seeing other healthcare professionals other than yourself. So it is a nice eye-opening experience that we can offer here. We will have some other opportunities from time to time for you to collaborate with other programs more one-on-one. So we at times have done a collaboration with our PA students where the PAs actually taught our students how to identify traumatic brain injury and concussion, which I think is really important for optometry students, given that you work so closely with the head. And then in exchange, the optometry students taught the PAs how to use a slit lamp. So I think that's the beauty of it all, that there's something to be learned from everyone. I do also want to point out some of our, before I move on from there, I'd love if our current students could share maybe one of their memorable IPE events that they have participated in. I know, Catherine Ann, you're only just in your first year, so I think you've had just the introductory one so far, but if you guys could share what that's been like so far, that would be much appreciated.
Yeah, so I participated in that introductory general knowledge event where students from all programs were assigned into small groups in which we talked about the roles and responsibilities each profession has. But it was really interesting learning about each program in comparison to optometry. And then at the end of the event, we were given these situations where they presented a patient to us, and then we had to talk about what we as a professional could do to treat and manage, and then what the patient's next steps would look like. So it was a really true eye-opening and learning experience, as I got to see a glimpse into like the everyday life as an optometrist.
Yeah, I
Thank
agree.
you.
We also did the same thing in the first year of the fall semester. And another thing that I did as well was we also gathered again in another group, and we did learn about substance abuse and addiction, and what are the signs and symptoms to identify individuals who are in need of help. And we also learned how to use Narcan in case of emergency. So these are some of the things that we get to do with different programs.
Excellent. Thank you both for that insight. And I do want to point on this slide too, there's a little bit about our different student support services that we have in place. So it is important to note that MCPHS is a pretty big university. We do have over 100 programs in healthcare and the health sciences. So we're not just a standalone optometry program. So we do have some robust resources for you, whether you're looking for your faculty support, peer tutor support, professional tutor support, whether you need counseling services or career services. So these are all things that are available to you through the university free of cost. So we're going to finally get into the nitty-gritty details of it all and talk about our optometry program specifically. So this is a cohort that launches once a year, which is every September, or I guess you could call it a fall start. And it is a 4-year program with 3 semesters a year. So there is a fall, spring, and summer semester. There are a couple of weeks of a break in between each semester. So you're not going, consecutively for 4 years straight. You will still get your holiday break and such. So with that, we are I'd say small to mid-sized cohort. We have about 64 students in our cohort each year. We like that number because it breaks down to 16 students per lab. And when you are in the lab setting, you can expect support from 2, if not more, faculty members at a time. So we can instead consider this to be an 8-to-1 student to faculty ratio, at least in the lab setting. I also want to note that you do have what I like to call a buy one, get one deal with this program for a Master of Public Health, which you can complete simultaneously with your optometry studies. And it won't start actually until the 3rd semester of the program, so you can at least get your bearings for the optometry program before you do decide to add the MPH to your course load. And the MPH is a really great credential to add to your tool belt, especially if you're looking to go into education or access and advocacy. And we do have Dr. Waldorf with us today. So if anyone has any questions about the dual degree, I think he'd be a great resource to elaborate on that. But just know that the courses are online and asynchronous for those that are looking to go through the MPH. So you usually get your assignments at like the beginning of the week and have until Sunday at midnight or so, depending on the course. So it does at least give you some good flexibility to put optometry first and then maybe finish up the week with whatever else you had for the MPH. In addition to that, I would like to kind of point out some statistics at the bottom of the screen here, just regarding our residency match rate. So some students after this program have decided to pursue an optometric residency, and we've had a pretty strong track record at getting students matched with an optometric residency that's been consistently above national average for the last several years. So a residency is a great opportunity for those that are looking to, potentially go into specialty. So I'd highly encourage you to consider that. They say residency is equivalent to about like 5 years of working experience in one. So it is definitely a great way to hyper accelerate your resume. But next, we're going to talk about, or we're going to go through a breakdown of what each year of the optometry program does entail. So best person, I think, to talk about first year is Miss Catherine Ann, who is currently experiencing it for herself. So, Catherine Ann, would you be able to share with us what you've been kind of experiencing through year one as a first year student in the program?
Yes. So my first year has been really like the foundational year, I'd like to say, featuring a lot of lectures, a lot of labs, just to kind of, like I said, establish that foundation that'll kind of be built upon. A major theme throughout the program is that early clinical exposure piece. So I know like me and my classmates will begin seeing patients as early as our fourth semester, so 2 semesters away from me. But within my first year, I will be spending a lot of time like observing our upperclassmen who are already in the primary care clinic, as well as sitting as patients for them.
Excellent. Thank you so much. And students will also have the optical rotation in their first year, and they are going through Jumpstart periodically. Are you able to tell me a little bit about Jumpstart and your experience with it so far?
Yes. So for my first semester, I had 8 sessions of Jumpstart, and it was kind of talking about studying techniques, how to create a more graduate style approach to studying and learning rather than depending on what you've previously done in the past. My last Jumpstart was actually last week, and they brought in a third year student to talk about what she's been doing to prepare for the boards. And it's kind of been really nice to hear from upperclassmen, professors, and other students and like what's working for them, what's not working for them. It's more conversation style rather than a lecture. So it is really beneficial to sit in on these because you're constantly learning something new. And if you're not taking anything away, then you're just not listening. So, I mean, I really like the implementation of the Jumpstart into the program because I feel like I'd be lost if I didn't have it.
And that's exactly the point of it, is just to make sure everyone's on track and progressing well, and making sure that they are on track with all of the new information that we're throwing at them, because it can be a bit jarring for students when they're first entering an optometry curriculum. So we did design the Jumpstart program to really ensure a smooth transition. So those that begin first year can expect to experience Jumpstart the summer before, really, leading into orientation with a couple of sessions scattered all the way into year two. So that will bring us to year two then. And with Nazine being one of our second year students, I'd love to turn it over to her to share a little bit about what you can expect to experience as a second year student.
Yeah, for sure. So second year really builds on the foundation from the first year. So starting in the fall semester, we actually begin seeing our own patients at the Eye and Vision Center with the support of the clinical facility, the faculty and the preceptors. But as the year goes on, the experience becomes more disease focused, and it's really great because it allows to apply what we learned to real diagnoses and patient management really early on. But in addition to clinic, we also do go out in the community to provide eye exams at school and also community centers. And we do serve diverse population. I believe it's with over 30 languages that are represented. But through our partnership with the Worcester Public Schools, we are able to provide free eye exams and also some glasses. Doesn't matter with the insurance. But we do rotate through the optical shop in the summer semester of our first year, where we learn how to order, adjust, and repair glasses, which is really great because it actually gives on hands-on experience with the optical side. And we do get to learn the business aspects of optometry as well. For example, we do like frame selections and we learn about the lens options. So it's really great to have that experience before we graduate and go out into the world. But another fun thing I wanted to add quickly is that we also just added an edger machine to our optical shop, which has been really fun to use because it actually allows us to make glasses in-house from start to finish. And it's really great because it actually really helps us understand how prescription turn into an actual eyewear. And it's really fun to use that as well.
Thank you for
And
that. That's oh, go ahead, Dr.
Oh,
Waldorf.
I just wanted to add that one of the things that we added this past fall was we added a 6 hour session of Jumpstart for clinic. And so what we did was we addressed like the first 2 hours was just like, what to expect, ask any questions. We spent 2 hours on like communication skills where, you broke into small groups and role played on, how do you explain this to a patient? And then we also spent 2 hours talking about how to receive feedback from your preceptors because a lot of students think that they're just going to be criticized for the mistakes they make, and that's not what we want to do. So we've worked a lot to try to make sure that there's solid scaffolding around you when you enter the clinic the fall of your second year.
Absolutely. Thank you for adding that. That does extend, like I said, into the second year. So what Dr. Waldorf is talking about is that continuation of Jumpstart, preparing you to start, taking that next step into your studies of optometry to start seeing patients. So next, we're going to talk about year three. So year three is really going to be dedicated to a lot of specialty clinics. So you've kind of built your foundation in primary care and starting to see a little bit of disease, but we're also going to expose you to a lot of different areas of specialty clinics, including pediatrics, binocular vision, low vision, glaucoma, contact lens, dry eyes. We do teach the full scope of practice of an optometrist. So I always like to share this example. There are going to be some skills that you can practice in certain states and some states that don't allow certain skills. So for example, I believe Massachusetts is one of those states that does not allow use of lasers, whereas other states will allow it. However, we do teach it within our curriculum so that you're prepared to enter whichever state you choose to practice in. In addition to that, during year three, you're going to start rotating through our community health centers. We do have 3 off-campus community health centers within a 30-minute radius of Worcester or so. So we have one in Worcester, one in Framingham, and one in Milford. Really up until this point, everything's going to be pretty much on campus until you enter into the community health centers. And you do see a wide range of patient populations in our community health centers. Dr. Waldorf, I guess I'm going to just turn it over to you. If you could tell us a little bit about the patient populations that our students do experience when they are working in the clinic.
Yeah, I mean, Worcester is a city of immigrants, and so there's people from all over the world in our city, and so you will be very well versed in how to use translation phones and translation iPads and services to communicate with non-English speaking patients. But each of our clinics, in like the community health centers, we're affiliated with Edward M. Kennedy Community Health Center, and we have a clinic in Worcester, one in Framingham, Massachusetts, and one in Milford, Massachusetts. And each one has their own flavor. Like the Worcester Community Health Center, the site in Worcester actually has a pretty large Hispanic and Muslim population, whereas like the Framingham and Milford population tends to be a little bit more Brazilian, Portuguese speaking patients. So I mean, it's, and the one thing I love is, I'm a big advocate for public health, is that our community really aligns well with like our mission of taking care of those who are underserved, as well as like our dual OD MPH program. So, that's something that ties really well. So you will have a lot of experience working with a lot of different cultures, and, being able to respect that and kind of understand how to work within that context when examining different patients.
Perfect. Thank you for that. Also, to anticipate in year three is preparation for part one of national boards. Usually students will take part one in the spring semester of year three. So we do have a boards review course that students will participate in the fall semester of year three, as well as the university does purchase a boards prep course for students to work through on their own time in preparation for part one. And then we're going to talk about year four. So year four is going to be your externship year. Since we're kind of on the topic of boards, usually take parts 2 and 3 kind of in between years 3 and 4, depending on the timeline that you are going for. So continuing on that trend for part 2, that's going to be more of that case-based exam. So we do have a Blackboard organization with all sorts of different test prep material and case questions to help students prepare for part 2. We actually just got our scores back for part 2 just a couple of days ago, and we did really well. I think it was 89% pass rate for first-time test takers. That was awesome. Always love to hear that. And then for part 3, that is that in-person hands-on exam that you have to go to North Carolina specifically to take. We really mirrored our own we mirrored all the same exact equipment that they have there in North Carolina in its own designated room on campus. So you can get assigned there to move through practice exams with our faculty members, as well as skill station to really get familiarized with the exam, the equipment you'll be using, and the format. So really helps to minimize the margin for error there. And we've really seen a nice upward trajectory on our board scores since implementing all of these different initiatives over the last several years. So we do continue to improve and look forward to that upward trajectory to go. But also in year 4, you're going to be going on to your externship rotations. So we do have 3 16-week externship rotations that take place really all across the country if you wanted to. One will be a community health center, one will be a VA working with veterans, and one is an elective of your choice. So with that elective, if you are interested in a specialty, you can certainly pursue a clinic that caters to that given specialty of interest, and you will work with a clinical coordinator on those sites. We have sites all across the country, as far west as California, even rural Alaska, as far south as Texas and Florida, and really everywhere in between. You don't have to travel if you don't want to. We do have a lot of sites that are, of course, focused within the New England area, but you can work with the clinical coordinator if you would like to set some up, close to home, wherever that may be or whatnot. In addition to that, students will begin working on a capstone project in year 4. Dr. Waldorf, would you be able to give us any insight as to what the capstone project typically entails?
Yeah, so during your 3 externship rotations, Dr. DeLiso, who's the externship director, she kind of guides you through like how to pick a case that would be interesting to develop a poster out of. And so at the end of the academic year, like in late April, we have it's like 4 nights, I think, of the 4th-year students just giving like grand rounds presentations after grand round presentation about these capstone cases. And then what Dr. DeLiso also has them do is submit them to the American Optometric Association for the ability to present their posters at Optometry's meeting, which happens every summer.
Excellent. Thank you so much. So definitely a lot of fun things to anticipate for year 4, in addition to residency applications for those that are looking to potentially be considered for one. And we do have a whole career services team, as well as our faculty members that are willing to help with these residency applications throughout that process. Is you able to add anything about the residency application process and placements?
Yeah, so we really advocate strongly for students to consider doing a residency. It's a 1-year program after you graduate from optometry school, and it allows you to kind of hone your experiences into something you're interested in. So I went to school in Oklahoma. I'm from the Midwest, so it was a very disease-based program, and that was great. But I'm like, I really like to work with kids. That's what I want to do. So I did a 1-year residency in pediatrics, and it really kind of that, like, it's like 5 years of experience in 1 year. I think there's a lot of truth to that. I mean, it not only allows you to really focus on what it is that you're interested in and dive deeper, but it also kind of gives you these connections that you utilize the rest of your career. So, we encourage everybody to do that. I mean, we understand that a lot of times there's a lot of student loans that people want to get started paying off, and we certainly understand that. But if you can swing it for the 1 year, we do encourage that. And there are residencies all over the country. They can be, optometry based, university based, Indian Health Service based, community health center based, VA based. So there's lots of different opportunities to kind of up your game, and it does give you a lot of, it gives you a lot more street cred when you're applying for jobs and positions, and helps you become a fellow earlier in the American Academy of Optometry if you choose to do so. So there's a lot of benefits from doing a residency.
Absolutely. Thank you for that. And I was hoping you could dive deeper into the different facilities and resources that we have for our students on campus, as well as the different lab spaces that they can expect to experience within the program.
Yeah, so we've really kind of developed this program. We have a sequence of courses called Optometric Theory and Methods, which we just called OTM, which is basically teaching you how to, do the eye exam. And it's a sequence of 5 different courses, but the first 4 are the ones that prepare you to do the eye exam front to back. So in the fall semester, when you enter of your second year, when you enter the clinic, we're really, slowly transitioning you out of what you've been taught to OTM and helping you apply that to patient care. One of the things is you're going through the OTM curriculum, you have 24/7 access to the preclinic area, which is where all of the different bays of, I think there's 8 in each. Correct me, am I wrong, Nazina and Catherine? Is it 8 in each room?
Yeah.
Doesn't matter. But okay, anyway, so that way you can practice your skills at any time. So that's what Catherine was referring to earlier. It's like if she wanted to get up and practice her retinoscopy skills or slit lampic skills, she could do that at 2 a.m. And whatever, it's down there for them. So, but what we've done is because we enter you, into the clinical training so early, as I said before, we really provide a lot of support for you. So, the first semester when you're in clinic, we really focus on your case history, your entrance testing, and measuring for glasses with the refraction. A few weeks ago, Nazine had to undergo a skills assessment for slit lamp. So that's what we're going to focus on the second semester in clinic, and then the summer semester upcoming this summer, we'll focus on developing your evaluation of the retina skills a little bit more. So that's kind of how we have it set up. I mean, we do have a VR magic room where you can practice your BIO skills, which is a portion of your retinal evaluation. But we're very supportive. One of the things that we do, not only on the didactic portion, I can speak clinically, only clinically, is that if we suspect that, maybe you're not performing to where you should be, we have ways of identifying that quickly and getting you additional help so that, nobody falls behind in clinic, because we want everybody to stay on track to complete their graduation, as expected.
Excellent. Thank you so much for that insight. And a big question I often get from prospective students just asks about a lot of the different research opportunities that could be available to them. And I understand that research is important to some students, depending on where exactly they're looking to take their education once they graduate. So yes, we do have research opportunities available. It is actually a requirement for some of our faculty to some extent to be working in research. So you can often get paired with a faculty member on their research, or you can even design and perform your own research with a faculty mentor. We have university research funding available, and we, of course, are big advocates for you to present your research at like local and national conferences like Academy and such. So we have done in the past even some collaboration internally with some MCPHS programs. So we've even done a drug study in the past with our pharmacy students. We've even used virtual reality as a form of vision therapy with our occupational therapy students. And we also have some great external research that's going on outside of MCPHS that we might be clinical partners with. So Dr. Waldorf, I'd love if you could share a little bit of insight as to the different research initiatives that we've been involved in the last couple of years.
Yeah, I mean, anybody, if you have an interest in research, certainly just, self-identify yourself. We have an associate dean for research, and he'll definitely be happy to hook you up. We've done a fair amount of research on like eye tracking in our pediatrics department. Our low vision department had a collaboration with several other schools, including like Harvard and Scape Institute, and where we were looking at like using, they're called Peli prisms, to kind of expand the visual field for individuals who have low vision loss. And so there are a lot of opportunities. And certainly if you go through the ODMPH program, one of the options you have is to do like a public health paper or research, project. So there's certainly a lot of opportunities. I know that we've had students do some research collaborations with the medical students over at UMass Chan. So, it's with a lot of things with our program. If you have an interest, we will definitely try to help, feed that interest and, allow you to kind of run with it as much as you can.
Absolutely. I think that's one of my favorite things about the program is we can certainly cater to your interests in a variety of different ways. So hopefully this all sounds exciting to you guys and you can envision yourself submitting an application in the future. So I wanted to share a little bit more details on how you can go about submitting an application. So if you have never heard of OptumCast, that is our centralized application system where you would need to begin your application. So they just make sure that you have everything that you need and have checked all the boxes before they distribute your application off to MCPHS. So we do ask that you submit all of your official transcripts to OptumCast. You have to make sure you include all transcripts. So even if you happen to take one random course at a community college one summer, just make sure that you are including it in OptumCast, as it could delay the review of your application. Most students do apply with a bachelor's degree or a bachelor's degree expected prior to term start. However, there are a handful of students who may apply in their junior year with 90 credits by the time they matriculate into the program. So that is the minimum amount of college credits that we do require for the program. We don't necessarily require a bachelor's degree, but we do prefer it. And there are a number of prerequisite requirements that should be met for the program. So that is listed on our website if you would like to see a complete list. A lot of sciences, some chemistry, physics, biologies are required for entry into the optometry program. You are still eligible to apply to the program with a couple of courses in progress or planned prior to matriculation, but everything does need to be completed with a grade of a C or higher prior to entry. Another big aspect of the application process is the standardized test piece. We do consider a couple of different types of exams, but the most common one is going to be OAT, the optometry admissions test. It's really catered towards those that are, looking to enter optometry school. So we do look for scores in the 50th percentile and above, regardless of the exam that you're taking. We will consider scores slightly below the 50th percentile, but we do really take a holistic approach to the application process. So if you aren't able to quite meet that 50th percentile on the OAT or whichever standardized test you decide to take, you really should be showing different values or strengths in other areas of the application, such as your academic performance or your involvement in research or different clubs and organizations and shadowing experience, volunteer experience, your letters of recommendation. We really do value all of these different aspects, and they do contribute into your overall review when we do receive your application. We don't necessarily require experience for our program, but it is highly recommended. We never want to put barriers up on this program. So, we can understand if students may have difficulty receiving shadowing experience or working experience opportunities. So if at any point you're not able to necessarily get like shadowing, we do encourage you just to make sure that you're doing adequate research, that you're fully understanding the roles and responsibilities of an optometrist, so that when you do come to interview, you can kind of, speak to your passions and interests for wanting to become an optometrist in the future. We do require letters of recommendation. They should be professional in nature. So if coming from a faculty member or an academic advisor, we're really looking for them to be able to speak to your academic performance. We do also like to see them come from a manager or supervisor who can really speak to your work ethic and your character, as well as it's also great to have one from an optometrist who, we've maybe worked alongside or shadowed for a good amount of time. We always encourage you to seek out letters of recommendation that are of quality, not of quantity. So if you're getting a letter of recommendation from someone who you've shadowed for like an hour, that's probably not the best person to appoint for a letter of recommendation, because it's clear that they, don't know you that well and can only elaborate minimally as to their experience with you previously. For those of you who have completed coursework outside of the US and Canada, outside of study abroad as well, we do require a WES or an ECE evaluation to kind of translate those courses into a US equivalency. So we will ask for that with your OptumCast application. So just note that that is an extra step that you will have to take if you have completed a degree or a significant amount of coursework abroad. And if you meet our minimum requirements, you can typically expect to receive an interview by invitation only. We do have interviews either in person or virtual through Zoom. So you can, pick whichever one you would prefer. Of course, we'd love to have you on campus when we can. However, we understand that if you're, interviewing from California, that might be a costly plane ticket. So no harm, no foul if you do opt for a virtual interview. We do have opportunities to visit us in person in the future should you wish. So our application for the fall of 2026 term start is currently open, and we are actively reviewing applications and interviewing at this time. Our deadline is May 1st. However, we do encourage everyone to apply ahead of that deadline since we do have limited seats. And as we get closer to that deadline, less and less seats become available, and there is, a chance that there might not be any seats available before that deadline does come up. So I always do encourage you to apply early. There is still time to apply. I would say certainly apply in March at the latest at this point if you are, looking to be strongly considered for a spot in this year's cohort. And we look at applications not only through, your OAT scores and other standardized test scores. We are going to look at a couple of different metrics in terms of your GPA. So, of course, your cumulative GPA is something that we'll consider. OptumCAS does calculate a cumulative GPA that we go off of. So if you've ever retaken any coursework, just note that OptumCAS is going to include both the original grade and the new grade in your calculated cumulative GPA. So if you're not anticipating that, your GPA could be slightly lower than you expected, since some schools do participate in GPA forgiveness where they might drop the original grade earned. So just wanted to note that. We do also consider your prerequisite GPA as well as your total science GPA. All of these should be above a 3.0, at least we recommend for it to be. We also want to see that you have a genuine interest in attending MCPHS and pursuing optometry. So don't overlook those supplemental questions that ask you, why do you want to be an optometrist? Why do you want to pursue MCPHS? Where did you hear about MCPHS? It does go a long way to make sure that you are doing research into all the different programs that you're applying to. I think that there are quite a few things that make our program unique, which hopefully you've gathered through today's presentation. So hopefully you've gotten a couple of talking points that you can add to your future application. So make sure that you are showcasing that when it does come time for you to answer those questions on the application itself. I do also want to note financial aid. So domestic students are, of course, eligible to apply to the FAFSA. There are going to be some changes coming to the FAFSA that will be impacting our 2026-2027 academic year, mainly that Graduate Plus loans are now going away. That was what this program was primarily funded off of in the past for students who were seeking out the FAFSA. However, there is still funding available through FAFSA. It will just be caps on the amount of funding that you can receive through the FAFSA. So I would encourage you to make an affordability appointment with our student financial services team in the future if you would like assistance with, figuring out how to best finance your education for the future. Our team is happy to kind of go through with you and give you some suggestions on best practices and whatnot. But the good news is we do offer merit scholarships for this program. Everyone is awarded a merit scholarship upon acceptance, and the amounts do vary, but we are currently giving awards of up to $15,000 per year. All right, so this is the last slide I have for you, and I'm going to kind of copy and paste this information into the chat if you wanted to take any of these links with you today. But now is a great time to start putting in some questions into the Q&A on your screen if you have any final questions for us to answer. But I'm going to copy and paste this slide into the chat for you. So if you ever do want to visit us in the future, that visit page that I linked will give you a link to our campus tours. We also have an upcoming event on Saturday, March 28th in Worcester, where it'll be a big event for not only the optometry program, but all programs that take place out of our Worcester campus with more focused types of like immersive events and tours that are more program specific for those that do attend. So it'll be a fun one. There's going to be a lot of swag and food and different faculty support and current students. So I do encourage you to attend if you happen to be available in the future. Our YouTube channels are a great place to check out if you're looking for more content about the optometry program specifically, as well as our Instagram pages too. So at MCPHS Opto, great Instagram to follow if you're looking to hear about the latest information and the latest things that our students have been up to. All right, so we do have a couple of questions that have been submitted, so we'll start clicking away at those. First question I do see just asks about pass-fail courses during the COVID era. Yes, we do consider pass-fail courses taken within 2020, so you can certainly apply and we'll take pass courses for prerequisite credit, no problem. Let's see. So another question asks about, how to stand out when applying to optometry school. We can kind of go around with this question, but I'll say my piece from the admission standpoint. We do really appreciate it when you are, showcasing that you've, like I had said in the last slide, that you're showcasing that you are genuinely interested in the program that you're applying through the different research that you are inputting into those supplemental questions. So that shows us that you're genuinely interested and you're not just firing off 10 different applications and seeing what sticks. So make sure that you are fully answering the questions within the supplemental questions as to why you are interested in MCPHS specifically, what makes MCPHS different to you than the other schools that you're interested in applying to. Do you have anything else to add to this one, Dr. Waldorf?
Yeah, I mean, just kind of be yourself. I mean, you don't have to have a super clever essay or anything like that. I mean, although that, can be entertaining, but no, I mean, I'm looking for it's funny just from like the essay, how much you can tell that a person truly does have a passion for entering optometry or entering the profession. And I also think that the more time you can spend, shadowing and talking and learning, the different things that optometrists do and understand and being able to explain the different things that you've learned through your shadowing experience. Those are all things that show us that you are truly committed to the profession. Because we don't want you to think you want to do it and then get here and then realize, ooh, I don't want to do this. And I mean, we've seen it happen before. It's always going to happen, but that's what we just try to prevent. So if you're truly a gunner and excited about it, show us what you got. Show us everything you've done and what you know.
Excellent. Thank you. Let's see. The next question asks about just the financial demands of optometry school and how MCPHS can support students in this way. Yes, we do try to do our best, of course, to support students and with the financial aspect. We understand, going to graduate school is no easy feat. It's definitely a commitment of not only your time, but your resources. So, like I said, we do come out with a merit scholarship offer to everyone who's admitted into the program. So you can anticipate on getting some sort of merit scholarship offer. We also, never want these to be barriers to your enrollment with us. So if there's something that we can do to help, kind of bridge that gap for you, we're certainly happy to look into it a little bit further. Of course, we don't have the capacity to do, full rides for anyone, but within reason, we're happy to see if we can meet you in the middle financially if finances are ultimately becoming a barrier to your enrollment.
We also, I'm sorry, but we also have our learning management system is Blackboard, and we also have a Blackboard group that one of the faculty is constantly posting like scholarship opportunities. And a lot of these scholarship opportunities might be for $1,000, $2,000. And, like in a lot of situations, like each school might have, the opportunity for a student in like the third year class to get a $2,000 scholarship. So we also try to support you through that by, showing you that, all of the scholarship money that's available for your particular cohort. She's got this really worked out well where second year scholarships would be, sent to them and third year scholarships and et cetera. So we also try to work that outside scholarship angle for you as well, because there's a lot of money that's given to optometry students from industry, from the United States and Canada. So there's definitely some options there as well.
Yeah, that's a great point. Thank you for that. And yes, another question asks again about scholarships just being available later into the cycle. Yes, everyone is automatically considered for a merit-based scholarship upon acceptance into the program, even those that apply a bit later into the cycle. In regards to the 2027 term start, that application will open at the end of July. So you could begin your OptumCast application then. So July of 2026, that application will open for the fall of 2027 term start. Another question asks about post-baccalaureate programs for people that are, non-traditional and looking to pursue optometry in the future. There are post-baccalaureate programs out there. I would encourage you to do some research since there are some that might be offered in person at local schools in your area. I know that there's some online ones as well. I think like Northeastern, University of New England. Those are some ones that I know of off the top of my head that have like a post-baccalaureate pre-med program. But typically the pre-med post-baccalaureate is going to be a good one that will get you set up with the prerequisites that you need for entry into this type of program. Whereas if you are looking to just kind of fulfill some prerequisite courses, we will accept coursework from any regionally accredited institution, including community colleges and even some online courses. We do offer online prerequisite courses through our School of Professional Studies as an option. So you can just even Google MCPHS School of Professional Studies. We offer all of the optometry prerequisites through there. And you can even get 50% off of your first course if you request a discount code for them from them. So that link is on their webpage on our website too. Another question regarding GI Bill for veterans. Yes, this program does allow you to utilize your GI Bill if you would like to utilize that. Our student financial services counselor, Lynn Berry, does offer you to meet with him one-on-one, and he's kind of our VA guy, as I like to call him. So if you wanted to speak in more detail about how that could work, I'd be happy to put you in touch with Lynn in the future. Let's see.
I want this one.
Okay.
So yeah, when I was talking earlier about, having flexibility and stuff, I was also referring to the clinic. And so you will actually, start working with kids the fall of your second year, because then we start you going out doing school screenings, on a rotating basis. And so that'll kind of get your feet a little wet with that. And then your third year, as Hannah had mentioned earlier, that's when you start doing your specialty rotations. Now, the ones that are really heavily emphasized are like ocular disease and glaucoma and contact lenses. And then you will spend some time in the peds clinic and the low vision clinic. But we have a lot of students who are like, I really want to work with peds. So you can spend, you let us know. And then what we'll try to do with your schedule is like, we can try to give you more sessions in the EVC peds clinic, but also like every Thursday, I'm doing some type of pediatrics work in Rhode Island. So one day a month, we're down at the Providence Community Health Center. They save all of their complicated cases for us. And we spend the whole day just doing nothing but kids' eye exams. It's a blast. And then also the other 3 weeks, Thursdays of the month, I'm the preceptor for a clinic called Insight, where we examine examine children with intellectual and developmental disabilities. So what I'm just basically saying is that if you again self-indicate to us that, hey, I really would like more peds experience during your third year, we can definitely do that. Just like with research. But if you have that interest, just let us know. But you'll start the fall of your second year doing school screenings. And that's like guerrilla optometry, man. You might be crawling on the floor to get some of that data from those kids. That's rough. But if you can do a school screening, you can do anything.
That's too funny. I believe that for sure.
They're rough.
All right. Well, that brings us, pretty much to the hour. It looks like we've gotten through all of your questions. So if you do happen to think of anything later on, feel free to send me an email. I do also offer counselor appointments one-on-one if you would like to discuss your own, future application in more detail and would like some more insight on anything. So feel free to connect with me at any point. I'm happy to help. And I do want to thank our faculty and current students who have taken time out of their evening to join us and to share their experience and expertise on all things MCPHS optometry. It's been a pleasure to have you all. So thank you for joining us. We hope that you have a wonderful evening and take care. Bye.